Hi everybody, this is Dr. Jordan Stewart from Timonium Foot and Ankle Center. I am super excited to be here today with the owner of Charm City Run, Josh Levinson. Josh, thank you for having me to your Timonium store. I am a podiatrist, foot and ankle surgeon, foot and ankle specialist in Timonium, and one of the biggest things that makes my patients get better is proper shoe gear. And I have to attribute Josh and Charm City Run to making that happen. I can't tell everybody how important shoes are a big part of getting better. Patients come to my office, they have plantar fasciitis, bunions, hammer toes, Achilles tendons, ankle injuries, and this is one of the first stops that we have them come to. So today, we're super lucky to have the owner himself, Josh, here, who's going to take us through how important and what the process is to fitting a shoe. So Josh, take us through the process. Why is it so important to have the right shoe?
Sure. First of all, thanks for the partnership.
Hey, man.
Thanks for being here. Thanks for spending time at Charm City Run today.
My pleasure.
So when someone comes into the store, we assume nothing.
Okay.
And we need to have a long conversation to find out where they've been and where they're going. So in other words, if you're treating your patient and they come in, that information is super important. We know that there's a medical situation going on. They're being seen by you, right? And we also know the kind of fitting that you want because we've worked together so long,
Absolutely.
which we appreciate.
No problem.
So we're going to come in and we're going to read the notes that you send us first, in terms of the type of last, the type of foot. You may make notes sometimes that say, hey, be careful of width. Or if your patient's a diabetic, be careful of seams. All those notes are super important to us and they help us along the process, okay? Then we're going to do a walk gait analysis. We just want to watch them in movement. Okay, see how they land, try to assess the pressure points. If they're comfortable, we're going to get them on the treadmill and see if that changes anything at a higher speed. Thank goodness you're such a dynamic podiatrist, but as you know, a lot of medical professionals, they watch folks and evaluate folks in a static state. We agree that we need to see people moving.
So let's just stop there. Let's stop there for 1 second, just because you're stating some great things, and I want to make sure all of our viewers understand that there. So I'm going to ask you a couple questions that you already mentioned. Just give us a very high-level explanation of the types of shoes there are. You mentioned the last of a shoe. What is that? Just so everybody knows, what does the last of a shoe mean?
Sure. So the last of the shoe is the most expensive part of making a shoe for these shoe manufacturers. And it's a heavy metal frame that they build the shoe on. And it's the shape. And we want that shape to match the shape of your patient's foot. Super important. Okay, so if you have a patient who's flat-footed, a severe overpronator, those folks that they get out of the shower and it looks like a big rectangle,
Yep.
right? They need to be in a straight-lasted shoe. Okay, so that's an example of one last. A lot of folks, the top of the bell curve is a semi-curved last. So folks that need a little bit of support, but there's still some shape in the shoe. And then that super high cavus foot, that's a curved last. And the shoe actually curves a little bit to match the shape of that foot.
Great. So everybody understands, Josh is pointing out, everybody's foot type is different. And that's the huge benefit of coming to a store like Charm City Run. And, one of the best things about Charm City Run is the variety. If we look around this room, we're sitting in the shoe area of the store, and there is such a massive variety. Patients a lot of times will say to me, I can just go online and buy shoes. I don't like that because the fit process is so important. You and I were talking a little earlier before we did this, and you kind of mentioned why it's such a great experience to come to the store. And, I want you to highlight that a little bit, the variety that you have here.
Sure. I mean, the whole spirit of running and walking specialty, right, is being able to try different shoes from different brands, okay? That's super important. So you need to compare 3 or 4 new shoes against one another. So you and I as a team, our job is to evaluate the type of foot that person has. But then we're going to try them in multiple brands. And it's ultimately the customer's choice, the patient's choice, what shoe to pick. But we need to narrow the selection set. When you're shopping online or at a big box store, you're self-selecting, you're guessing. There's too much choice. And the margin of error is too high. And that could nullify all the great work you're doing. If you treat the patient perfectly and then they go out and they buy a shoe that's not right for them, they've got pain. And we're so lucky that your practice is so dynamic that you realize that this is an important component for the whole fix to cure the patient.
Absolutely. So, I do a lot of custom devices in my practice. A lot of what I treat are injuries, sports-related injuries. I treat a lot of runners. Running is a big specialty component in my practice. And what we do is we make a lot of custom orthotics. We have a lot of patients with unique deformities in their feet that require custom devices. How do your shoes accommodate those? Can you comment on that? Do you guys, I know you do that for us, but tell us how you take that into consideration when you're fitting a shoe.
Yeah, absolutely. So, you mentioned a really important part of the shoe fit. So you make some fantastic custom devices, and when they go in the shoe, we need to evaluate the patient with the custom device in the shoe. For instance, you're usually building some support in that device depending on the patient. Well, then we don't need that support in the shoe. We don't want to overcorrect that patient because that leads to other injuries.
Absolutely.
All the shoes in here and in all running specialty stores, they are all going to have removable insoles. Super important. So that's another reason not to guess on your shoe purchase. Because if you have a custom device from Dr. Stewart, and then you put it in a shoe with an insole that doesn't come out, now you're riding on top of the water, so to speak. You're a boat in rocky waters, right?
Absolutely.
And now you have no stability.
Absolutely. And I can actually attest that I've seen that happen multiple times where I've made patients an orthotic, and I might have recommended one shoe that I thought would be good, and they've come to the store here, and I give them my blessing. They're the shoe specialist, and they modify the recommendation, and they get the patient in the right shoe. And there have been a couple times where the shoes were overcorrecting the patient, and the awesome part about this store is, they work with us. They swap the patients out of the shoes. So none of us are perfect, but if we don't get it right, the great thing about Charm City Run is they make it right. So
absolutely.
I do appreciate that, and I can't tell you how much my patients appreciate that.
I'm glad you're hanging out here today. And for the last almost 20 years since we've been in business, plantar fasciitis seems to be the thing that we can't solve. It afflicts people who are just getting started, for sure, as you know. What's somewhat even a little bit more mysterious is that serious runners who are fit, who have been running a while, seem to come down with plantar fasciitis, and nothing different has changed. We ask them about, has surface changed? Has total mileage changed? Has training intensity changed? And it seems like it can come out of nowhere, and there's nothing that I can recognize that's unique in their gait or one type of gait that's making it come on. What's your perspective?
That's a great question. At the end of the day, plantar fasciitis is an overuse injury. And, there's this one guy that I see at my gym, and he runs 5 miles a day, every day, 7 days a week, which is a lot of running. He runs on a treadmill. And he's never had problems with his feet. And that, to me, is like a major outlier. If you talk to most runners, which, you're a runner and you see and treat a lot of runners, I would say the vast majority of runners get some form of plantar fasciitis at some point in their running career, statistically. And, I don't think there is a real definitive event that has to happen other than the fact that it tends to be an overuse injury. Specific events that we may see it in, and I'll use myself as an example. I have had plantar fasciitis in the past. I had it really bad. I treated it after playing around with it for a little while, but I did treat it and I got it better. I wear the shoes that you've recommended for me. I wear orthotics that I've had made. And I will tell you that barefoot walking does tend to be a big precipitating factor. I will tell you that in my experience, the longer distance runners or ultra marathoners that are running with more flexible shoe gear, they tend to be a little bit more prone to it because you're losing that stability or support in the foot. But the patients that just get it out of nowhere, it's sheerly an overuse injury, and it's just like anything with medical conditions. Most people, when they start getting it, they think it'll go away and they run through it. Do you see people running through it?
Absolutely. And I think part of it is that it's such a strange sensation at the beginning.
Yeah.
They get out of bed that first day and their heel touches the ground and they have that shot of pain, and then the pain sort of dissipates the rest of the day and they say, well, I'm going to be okay, and they go out and they do their speed workout.
That's exactly right.
And it gets worse, right?
Well, that's exactly right. What you're describing, Josh, is think of the plantar fascia like a rubber band, okay? The rubber band originates on your heel and it goes out to the ball of your foot. And what patients are experiencing when they get out of bed in the morning, that rubber band is nice and relaxed, and then they stand up and it yanks and it pulls. And as it pulls and stretches as they walk a little bit, that pain goes away. So the pain that they have first thing in the morning, or the pain that they have after they get up from sitting like we are right now, they'll take a couple hobbles and then they're on their way, so they think it's fine. But over time, they really will start to injure themselves. And one of the bigger injuries that we tend to see with plantar fasciitis is not just the plantar fascia itself, it's that they compensate. So they'll start running on the outside of their foot. Then they'll start straining their metatarsal bones, getting stress reactions on their bones. They potentially could stress their ankle. So there are a lot of injuries associated with it, and plantar fasciitis is one of those things that it's very challenging to get rid of unless you rest, and it can take a long time. You know, there's so many treatment options for plantar fasciitis: splinting, orthotics, icing, supportive shoe gear, recovery shoes, avoiding barefoot walking. I started to say earlier about myself is that when my plantar fasciitis recovered, I did notice that the more I would go barefoot or be in sandals, that it would start to hurt a little bit more. So the proper support is huge. Do you guys recommend recovery shoes to your
Definitely.
clients?
We have recovery sandals, and those have made a big difference. And I know you've been referring your patients for those. They have made a big difference for serious runners. When someone comes, break it down for me, when someone comes in the store and it's someone we've already fit in the right shoe, we know we've been successful with the shoe because we've been successful for multiple years, and they start describing plantar fasciitis symptoms, is my answer some of these home remedies like the frozen bottle, well, while you're watching TV and
Sure.
that kind of thing? When should they come see you in the process? What's a symptom where they're like, they need to come see you right away?
It's a great question, because I think a lot of people, depending on the degree of the plantar fasciitis, I don't think it's unreasonable for people to do some simple stretching and some icing for a week or two. But if the symptoms really are not going away, it's important to start coming to the doctor within the first week or two if the symptoms just are consistent, because I find that a lot of times people spend time at home trying to do things on their own, and we have a recipe that tends to work. Statistically speaking, 99.9% of patients will get better with plantar fasciitis without any sort of surgical intervention. It's conservative care. I see 1,000 plus patients a year in my practice with plantar fasciitis. If I do 3 to 5 surgeries a year, for that condition, that is a lot. So you should try to start getting them to come in. It's not unreasonable to get them in a more controlling shoe, maybe even a guidance shoe, depending on their foot type. You look at their foot type, you look at their gait, you know what to look for. Absolutely recommending that recovery shoe or the shoe in their house to wear. But getting them in, we like to take radiographs. I know you do a gait assessment here. We'll do a separate gait assessment in the office. We'll look at their foot structure. We'll look at their radiographs. One of the other things that I find very common that tends to be missed by the patient is that they don't realize a lot of times that they actually have ankle pain. And it's very frequent that patients have some pain along their posterior tibial tendon. That's the tendon on the inside of the ankle that supports the foot or helps to invert the foot. And I find that tends to be something that they don't really recognize that they're having pain. Yet when we do a physical exam, they do have pain. And you have to kind of think of it as a cause and effect phenomenon. When they have pain on their ankle, which helps to invert the foot, it allows that foot to pronate a little bit more. And when it pronates a little bit more, their fascia is stretched more, and it's just aggravating that. So, a real thorough medical exam can catch that early and reduce it. Your average patient takes about 6 to 12 weeks to recover. The hardest part of the hardcore running population, or even the moderate running population, is getting them to shut it down. The good news is there are great other exercises. Getting on a bike, getting in the pool, weight training. You want to try and do things seated. So there are great options for plantar fasciitis, and I think that recognizing it early and getting on top of it early can really nip it in the bud.
And so for that serious runner, do you recommend aqua jogging? Is that a good way to keep your heart rate up? And
yeah, I think it's great. I mean, if you can get on a zero gravity machine too, those are great. Unfortunately, they're not that common, but aqua jogging is great. I think that cross training in general is great. So I think that I know runners really, when they're training for races, they have to have that mileage under their belt. But doing any sort of cross training, you can absolutely do during your recovery for plantar fasciitis.
And your patients, our customers,
sure,
they're pretty busy people.
Absolutely,
they're trying to stay out of doctors' offices as long as they can. But if they're having these symptoms, if they're having these feelings, and they call you, how long is it going to take them to get in, and how long will they be there the first time?
We typically will get our patients in, we try to get patients seen within a week, 7 to 10 days. And if it's really emergent, we make room for emergency appointments. I mean, if patients are in pain, if you call us, or if the patients call us for that matter, if they're in pain and they express that over the phone, it's really important that they express that over the phone. But if they're in pain, we will have them in within that week, regardless. If we have to double book them, we make it a point to see them because we want to be conservatively aggressive to get rid of their pain and really educate them on the process so that they can get back to running and enjoying what they love to do.
That's great. You do a great job for our runners.
Thank you.
If they go to your website, they can find information on plantar fasciitis.
Absolutely.
Can they also find some of those stretches and some education there?
So we do have some information on some of the treatment plans. I'll be honest with you. I don't put a lot of stretching exercises on my website. I'll tell you why. I like to use night splints, devices that stretch the foot. Mm-hmm. I think there's a double-edged sword with stretching, okay? Stretching can be beneficial, but the problem is it's very hard to hold and maintain a stretch for an extended period of time to make it beneficial. And I personally like passive stretching a little bit better. So passive stretching being holding your foot in a stretch position as opposed to really cranking it. Huh. And the double-edged sword, what I mean by that is it's kind of like this. If you have a bruise on your head and you keep banging your head against the wall, your bruise will precipitate. If you think about the mechanism of plantar fasciitis, the more you keep stretching it, and when patients stretch, a lot of times they tend to really crank it.
Right.
Because they're aggressive,
yes,
which,
right.
They're not intentionally trying to hurt themselves, but if you really crank that stretch, really what you're doing is you're kind of chronically agitating it. And, I'm not going to say that massaging or taking a golf ball or a lacrosse ball can't help with it. Mm-hmm. But again, I kind of go back to that same theory of if you have a bruise and you keep agitating it. A lot of times with plantar fasciitis, you'll get that first 75 to 80% of the pain gone reasonably quickly. It's that last 10 to 20% that just lingers and lingers and lingers. And I think sometimes overstretching or over manipulating can actually aggravate it. So, passive stretching is really more what I recommend. Icing for sure, avoiding the barefoot walk.
I know this is a large question, but how long is your average patient in a night splint?
It's a great question because I have patients, night splints are a 50-50 splint. And what split, excuse me,
gotcha.
Not split, yeah. A 50-50 split. I would say that 50% of the patients, so night splints, we tell patients to try to wear it for about an hour each night when they have plantar fasciitis. Some patients will wear it all night. When the patients are done with their course of plantar fasciitis, I tell them to wear it for at least a month after their symptoms are gone. But I would also tell you that there are patients that I've treated 4, 5, 6, 7 years ago, and they come in periodically just for a foot evaluation. Maybe their orthotics have run their course and they want to update their orthotics. And they tell me that they still use that splint every night because the pain that they have with that plantar fasciitis was so bad that they don't want to deal with it again. So the answer to your question is most patients, once their symptoms are gone, will continue for about a month. Mm-hmm. However, there are patients that just continuously wear it, and there's really no harm in doing that.
That's what I was going to ask you. So no downside.
No downside. And the big thing is that a lot of pathology in the foot is actually from the calf. Calf pathology, tightness in the calf, equinus, I'm not sure if you're familiar with that term. Yeah. Equinus is a calf tightening. And essentially what happens is when the calf musculature is tight, it actually leads to a compensation, which allows the patient to pronate their foot. And the benefit of the night splints is it's not only stretching your foot, but it's stretching your calf. So chronic stretching in a passive fashion, there's no harm in that whatsoever.
I cannot get my calves flexible.
Yeah.
I mean, it's a constant challenge.
Well, unfortunately, I tell patients this all the time, until I was a surgeon, I had no appreciation for how resilient our tissues are. Mm-hmm. And actually, one of the more common surgical procedures I do for patients who need it, that it's medically necessary on, is we will actually surgically release the calf tissue. We do a procedure called a Gastrocnemius Recession. And that's actually one of the more popular procedures now to treat plantar fasciitis for patients that are recalcitrant, that are not getting better with conservative care. So instead of actually operating on the plantar fascia itself, what we do is we can release the calf tightness And by virtue of releasing the calf tightness, that can eliminate plantar fasciitis pain. And that is for that small percentage of patients
Sure.
that are just
That
not
makes
getting
so much
better.
sense to me,
But
yeah.
the calf tightness is a huge part of foot and ankle pathology, and particularly plantar fasciitis.
And like most runners, I don't stretch enough.
Ha! Well,
Yeah.
yeah, stretching before, stretching after,
Right.
super important. But yeah, plantar fasciitis is a tricky one. It tends to get most of us. Have you had any symptoms of it before?
I have, and luckily I've had relationships with you and people like you, and I kind of know when it's coming on, and I
Right.
shut it down and do other things, right?
Well,
But most people that first time,
Yeah.
you know, they're aggressive, they love to run, they love to be outdoors,
Yeah.
and they just try to power through it.
well, I can tell you, I had it the one time really bad, and I had it. I had to deal with the pain for a little bit, and I will never ever want to go back to that again because it was pretty miserable. So, great, thank you so much, man. Appreciate it.
Great. Thanks for hanging out today.
Awesome, thanks.
Appreciate it.